Today we have with us Professor Ahmed Al-Mukhtar, who is Professor of Anesthesia and Intensive Care at Cairo University. Welcome to the show, sir. Welcome. Can you shed some light on the most common causes of liver disease that can lead to liver failure?
First of all, the liver disease, there are several types of liver disease that can lead to the liver failure. For example, the patient have a viral hepatitis, the hepatitis B or C. This may lead to the liver failure. Patient with some autoimmune disease with the liver failure. Some patient may have toxins that lead to the acute liver failure in very short term throughout. For example, drug-induced liver failure. Some drugs can induce liver failure. Maybe because maybe other types of or other poses like an alper can pose liver failure.
Alcohol, is it?
Yes, chronic infection with the
Okay. So, one of the major factors is lifestyle, we can say.
yes. If you have some there is for hepatitis B, there's a vaccination for hepatitis B. Okay, so it's routine run now so can prevent hepatitis B virus. For healthy life, for example, if you avoid excess fats on the diet, because some liver failure may be due to fatty liver, due to excess use of the carbohydrate and the fast food. This cause non-alcoholic liver cirrhosis. Health liberic you or may prevent consumption of alcohol. Vaccination for this type can prevent the
You have given us the causes. Can this be prevented after a person is diagnosed with it?
if the patient is diagnosed with the liver disease, yes, it is an early stage of liver disease and it can be prevent the progression of the early stage liver phase.
Okay.
Either by drugs, some drugs now have an anti-hepatitis virus, like hepatitis C or B, you have an antiviral, or my modification of the lifestyle, or to prevent the progression of the end stage liver phase.
Okay. And when does a person with liver disease need a transplant?
If the liver disease progress to the liver failure, this patient appear as and this may be done, will be occur acutely
Okay.
in case of the drugs toxins or in chronic conditions. If the chronic disease progress to the liver failure, the patient start to develop the jaundice, the yellow to discoloration of the skin, accumulation in the ascites, maybe hematemesis. All these conditions make some assumption that this patient progress to the allelopathy.
Of what are the types of transplant available in today's?
Usually, you have two types of the transplant for liver, ADC liver disease. Either cadaveric transplant, okay, which means that the patient takes the grafts or liver from the diseased or dead person, okay, and we have a living donor transplant. This addition that we have a liver transplant from the living patient. But in this part, we take a part of the liver, not all the liver from the donor.
Okay. And what are the complications to the person who donates part of his liver? How does that work?
Oh, for the donation.
Yeah, for the donor, who is always donor.
Post for the cadaveric one, there is no complication, which called actually the patient is died already. But for the living donor, there is some complication, of course, because it's a type of surgery. But the liver, the power of the liver, it can regenerate. So the patient can live with one third or one fifth, one half of his liver, and after 8 weeks, this liver regenerate again to make the full liver before transplant.
Okay, so it's totally safe.
It's not a totally safe, it's a complication, but it is, but the patient has a kidney transplant. If you donate one kidney, you can still live with one kidney. So it is possible, and the more the team are skillful at doing the liver transplant, you less the complication delivery.
Okay. Thank you very much for shedding light on liver diseases, the transplant, and the way in which it can be prevented in early stages. Thank you for being a guest in our podcast. It's an honor to host you as well. Thank you very much. We wish you all the best.